This case is a 49 years old male, known case of diabetes and hypertension. He has a history of inferior wall ST elevation MI with mild LV systolic dysfunction, and he underwent the angiography outside the hospital in somewhere else, and they have suggested to do the PTCA to RCA and LCX. So they presented to our hospital for the angioplasty. So this is the RC. You can see this is a Shepherd-Crook RC. This is right radial root with the JR catheter, and this is, you can see, the Shepherd-Crook RCA with significant lesion in the mid RCA. I'll show in the other view. And this is the lateral view, sort of RAO view, and you can see the significant lesion is there in the mid RCA. So in this steel frame, you can see there is a, near the arrow, there is a 70 to 80% stenosis in the RCA. So I decided to do the angioplasty after getting clearance from the state scheme. So it was a difficult task to put the wire with the JR catheter. This is a right radial root with the JR catheter, and I'm trying to put the wire with this Shepherd-Crook and tortuous RCA. And you can see my wire is going. After 4 to 5 minutes, somehow I managed to place the wire in the RCA. And they have presented after third day of this angiogram of this chest pain. So this is the without dilatation, I did stenting here. This is a 2.75 into 18 stent, and this stent is being deployed at around 12 atmospheric pressure. 8 was nominal, 16 was RBP, and this is a scene after angioplasty. This is the RAO view. You can see after RCA we proceeded for the LCX. There was a ulcerated lesion in the LCX, and you can see this is the right radial root, and this is the XB3 catheter. Even then the catheter was going into the LAD, so I changed the catheter to JL3. However, this JL3 catheter, you can see this catheter is sitting up to a proximal LAD, this catheter. So I just somehow I pulled back in the catheter and kept into the left main. So in this view, we can see somehow I managed to keep this catheter into left main, and then I proceeded for the LCX. There was a ulcerated lesion in the LCX. So you can see near the arrow, there is a ulcerated lesion in the LCX. So this is a BMW PTCA wire crossed in the LCX, and this is the placement of the stent, and we could have taken the small length stent, but this was okay. This was 18 stent, 2.75 into 18. So this was we deployed the stent at around 12 atmospheric pressure. Nominal was 8, RBP was 16, and this is the scene after LCX angioplasty. This was the angioplasty to RCA and LCX in this evolved inferior wall ST elevation MI, and you can see seems to there was a difficulty in crossing the stent in this Shepherd-Crook RCA, but somehow gently I managed to cross the stent, and support and wire support and everything we need to see. So thank you.